Welcome to Baby Behavior. Have you ever wished you could do more to help the families you work with make better infant feeding decisions? If so, this course is for you. Understanding baby behavior is one more tool in your toolbox, building on your existing skills to increase your effectiveness and support healthy babies. This training can lead to an increase in exclusive breastfeeding, a decrease in formula feeding, a decrease in overfeeding, and help in obesity prevention. This course will help you understand behavior in healthy, full-term babies from birth to 6 months. This course will help you learn why understanding baby behavior can help parents make better feeding decisions and reduce their children's risk for childhood obesity. We'll cover some of the secrets of baby behavior from birth to 6 months, such as how infants' moods affect their behavior, how babies communicate with caregivers so their needs are met, how healthy babies sleep, why babies cry and how to help parents cope with crying, and the importance of physical activity. We'll also model how to teach parents about these secrets. These secrets have actually been around a long time, but somehow have been lost in our busy technological society. Note that throughout this course we often use the words caregivers and parents interchangeably. Even when we say parents, the information is generally relevant to anyone who is caring for a healthy, full-term baby. Have you ever worked with a woman who seemed really motivated to breastfeed during her pregnancy, but shortly after giving birth changed her mind? The UC Davis Human Lactation Center conducted a study to find out why these new moms were making the decision to stop breastfeeding. Most of these moms said they didn't produce enough milk. When the researchers asked how the moms knew they didn't have enough milk, the researchers expected responses about wet and poopy diapers or insufficient weight gain. But few of these new moms talked about those clinical indicators. These new moms said they knew they didn't produce enough milk because their babies would cry and wake up at night. They assumed that waking and crying were signs of hunger, and they weren't giving their babies enough to eat by only breastfeeding. The study at UC Davis found that many moms feel helpless in dealing with their baby's behavior. They believe that babies cry only because of hunger, and that formula and cereal prevent hunger. For example, one mother in the study said, "When I gave formula, the baby no longer cried and slept, and that is when I decided not to give him breast milk." These moms believe babies wake because of hunger, and that they sleep better with formula and or cereal. Another mother said, "From the time maybe she was 3 or 4 months old, I started putting a little cereal in her bottle, and it was like at night, and it would help her. She would be full and sleep through the night." Some mothers believe that their babies will stay full longer if they are overfed. One mom stated, "My baby used to wake up, but now I'm giving him formula if he's already full and he no longer wakes up." Moms are also pressured by others to feed their babies whenever they cry or wake up at night, no matter what the reason. Many people have unrealistic expectations for babies, thinking that they should be quiet all the time. So new moms feel a lot of pressure to keep their babies from making noise and disturbing others. Even when new moms want to breastfeed, they may feel like they have no choice but to use formula and to overfeed in order to meet these expectations. New parents face many challenges. When faced with a stressful problem, parents have two main approaches for coping. If they believe that a solution is possible, they'll try to find ways to fix the problem. For example, mothers with breastfeeding problems would call a lactation counselor. Asking for help and trying different solutions are what researchers call problem management behaviors. If parents don't believe that it's possible to solve their problem, they won't ask questions or take any action. Instead, they try to calm themselves down. They might tell themselves, "Breastfeeding isn't that important, she'll be fine without it." Or maybe, "My baby is overweight, but he seems only to stop crying when fed." When parents don't perceive it as possible to solve their problem, they focus on controlling their own emotions, and they try to talk themselves into feeling better instead of addressing the problem. This kind of response is called emotional regulation. Focusing on controlling emotions instead of managing problems isn't just something new parents do. We all do this in situations where we feel no solutions are possible. Imagine you are driving on the highway in an unfamiliar area, headed to meet someone, and an accident causes traffic to grind to a halt. If you have your cell phone, you can use the map app or call someone to find another route, or to reschedule your meeting for later. You know you have a solution to your problem, so you take action. You do something to solve your problem. But what if you have no cell phone or GPS signal? What if you're stuck in the middle lane of bumper-to-bumper traffic with no way to even get to an exit? You know you can't solve your problem right away. You'll talk to yourself to calm yourself down. You'll tell yourself that the person you're meeting will understand about the traffic, or that it won't matter if you're a little late. That's focusing on controlling your emotions. It's the same thing a new mom does when she wants to breastfeed but tells herself, I wasn't breastfed and I turned out okay. Imagine a brick wall. If someone asked you to run through this wall, what would you think? It's impossible. It wouldn't matter if someone offered you $1,000 to run through it. The problem isn't lack of motivation. It's that you don't see running through that wall is possible. But what if someone showed you a door through that brick wall? Now you can get through that wall easily. If they don't believe there are solutions to their breastfeeding problems, new parents can feel like they are facing a brick wall. They sometimes make feeding decisions because they feel like they have no other choice. Even if they want to breastfeed, if they believe they have no other choice but to use formula to deal with crying and waking, then they're stuck at that brick wall. If you can teach them about their baby's behavior, you can show them the door in that wall. Parents need tools so they will believe there are solutions and that they can handle their baby's crying and waking without overfeeding. New moms often feel overwhelmed by crying and waking, and they may turn to overfeeding in response to baby behavior because they think their babies are always hungry. Moms may be sure that they aren't producing enough milk because the baby is crying and not sleeping through the night. If they are breastfeeding, they may start adding formula. When that doesn't work, they may add more and more formula. They may start solid foods like adding cereal in the bottle. Next, they may add other solid foods. They may feed every time the baby makes noise. If feeding is the only tool parents think they have when their babies cry or wake, then that's the solution they'll try for every situation, even when their babies aren't hungry. That response of feeding for every situation may continue to be the one parents turn to as their babies become toddlers and older children. In your agency, you may have already witnessed mothers feeding their babies to control their behavior. If you can show parents other ways to interact with their babies besides feeding, you can help decrease childhood obesity starting from this very early age. If parents are focusing on controlling their emotions rather than trying to fix the problems they face, they may appear impatient, rude, or uncaring when you work with them. You may see them turn away from you, check their watch, or cross their arms. When you see those signs, you'll know the parents already feel stuck and like they have no options. They really do want to work with you and listen to what you're sharing, so you'll need to show them that it's really possible to get through that brick wall. A new breastfeeding mom who has trouble, but who thinks formula is her only solution, may not reach out to a WIC counselor. After all, if that counselor has been telling her how important breastfeeding is, but she feels her only solution is to use formula, she won't expect the counselor to understand or have other solutions. She's likely to think the counselor will just make her feel guilty about her decision and that it's impossible for anyone to help her, so she's less likely to reach out. This training will help you work with parents so they see you as a source of possible solutions, and they won't feel like they have to struggle alone. You can help new parents make informed decisions about infant feeding. They need the right information to respond to trigger events that may lead them to choose to stop breastfeeding. Adding baby behavior knowledge to your existing expertise and WIC tools can help you support these parents. Clinics in the FitWIC Baby Behavior Study that use baby behavior training increased their 0 to 6 month exclusive breastfeeding rates by 7%, 43% higher than the rates when they started. The biggest increases were in the 1 to 4 month range. Formula use in the intervention sites dropped, even though the caseload increased. A great thing about the baby behavior intervention is that it's useful for both breastfeeding and formula feeding families. In this training, we will focus on using baby behavior to promote and support breastfeeding, but it's important for you to remember that the baby behavior messages are based on biology and infant development. Even a mom who has never breastfed may be confused by her baby's behavior and may make feeding decisions to try to calm crying or increase sleep. The messages shared in the following modules are useful for any caregiver who is unsure about a baby's behavior. This module introduced you to the baby behavior course. You learned about beliefs of new moms that may lead to overfeeding or use of formula and cereal. You learned how parents cope with the stress of a new baby and how some parents feel they don't have any choices or solutions other than feeding to control behavior. You can help parents make informed decisions by adding understanding of baby behavior to your existing WIC tools.